This is a very broad question, and there are many things that should be said. I'll talk from experience from things that I've heard that were very bad things to say. So, for example, I one of the things I liked to ask when I was interviewing, I'm actually not going to be interviewing actively this season, but from the past, what I've been interviewing, I said to them, okay, like, what are you doing? What are you, doing to read up? What are you doing to stay relevant? Because a lot of people either took a gap year or it's their fourth year medical school and they have been a few months out of clinical rotations. So what have you been doing to kind of just stay up to date and stay competitive? And they say, no, nothing really. I really wanted to take these couple months to relax before residency. So that don't say, because this shows them that you really are not a hard worker. You want to kind of use this time to unwind, and that's not what they want to see. So that's the first thing I would say. The other thing I would say is people who are not honest. Why'd you get a low score? Why do you have a few years of gap? So lying and things that are clearly, like, the selection committee aren't idiots. There are people who know, they've been in school themselves. They know what's an honest and dishonest answer. So lying is a very big red flag. And they, I took the time off to start up a startup company. What's the name of your startup company? Oh, I'm not sure. You know what I mean? Like things that are obvious. Like, obviously you want to just be honest and be truthful. If you had a bad score because you didn't study hard enough, just say that you didn't study hard enough. You realized your what you did wrong. And then for step 3, oh, look, I actually took off 6 months. I started hard. Look at my score. So honesty, integrity is really another thing they want to see. That's, I can go on for what do not to say for hours, but in a nutshell, that's what I'll leave it to for now.
Dr. Atoot, anything to add? Anything that just stands out in terms of not to say?
Yeah. So look, ultimately, I think that everyone here that's applying for residency was probably the smartest kid in their class, wherever they were, right? Most people, like in college. So you guys are all, the fact that you got into medical school to begin with shows me that you're a high IQ individual, right? The majority of the time. So just think of it rationally. Put yourself in the shoes of the program director for a minute and the faculty, and ask yourself, like, what would I not want to hear? So, for example, what do I want out of a resident? I want a resident that's, number one, reliable, right? Number 2, cares about the patients. For me, patient care is the fourth most. This is why we do what we do. This is why we built all of this, right? And somebody that's hungry for knowledge, because I can't teach you. I can't make you a better doctor if you don't want to be, right? And somebody who's self-motivated, right? Like, my job as a program director is to give you every tool at your disposal to be the best doctor possible. It's not my job to make you want to come to work or want to read. That's on you. You know what I mean? So we want those. So what are the certain things that you can say that make me think that you don't have those skills, right? So if you, for example, I ask you, hey, what do you have any question? Every program director will ask you, do you have any question for anything? And the first question that comes out of your mouth is, how many weekend calls do we get? How many night shifts do I have to do per month? How many ICU calls do you guys do, right? So sure, that's information that we share with everybody. Of course, we want you to know what kind of schedule we have. But is that really what you want to draw attention to, that you're paying attention to, right? Like, how many vacation weeks do I get a year? Well, like, all of these things are pretty standard across the board, by the way. Like, all ICU rotations, night floats are generally not different from program to program. But the fact that he thinks that that's the most important, what impression am I going to get? I'm going to get that this is somebody who wants to do a minimal job. He wants to come here and do the bare absolute minimum, right? So that's not somebody I would want. I would much prefer if they were saying something like, hey, like with Jay, right? So Jay and I, he was with me yesterday in the clinic, and we were discussing like scleroderma patients, right? I would much rather if he was like, hey, by the way, I wrote a couple of papers on scleroderma and I'm interested in like rheumatology. What kind of research do you guys have for somebody like me to expand on that in your institution? Perfect. That's something like Sim in charge of research, he would go crazy for. That's what he's looking for. He wants someone he can come with and he can do research with. Or somebody that says, hey, like, I would like to be very good with my hands. How do you guys like improve resident procedural skills, right? How can I get a good central lines or paracentesis or something? That makes me think that you're interested in doing well for the patients, right? What kind of community outreach do you guys do? I'm very interested in going to underserved communities. That's what I want to hear. I don't want to hear like, how many wellness days do you guys get, right? Like, you can ask, but you get what I mean? Like you're selling yourself. Sell yourself as a hard worker. And then all that other information is on the website. You can just find it.